Here we go, TBT back again with another anatomy breakdown, muscle by muscle. Today we're going to be hitting the biggest and the baddest, one of the few muscles that even the layperson knows its full name. Big player in gait, huge hip extensor, powerhouse of the posterior chain, one of the most important muscles of both athletic performance and upright posture. We're talking about Gluteus Maximus. Big boy both literally and functionally. It's the largest muscle in the human body, and its reputation is even larger. Sort of interesting, this muscle is basically a hallmark of humankind, especially lately. Other primates don't have a glute max that gets as big as ours. Relative to the body mass, our Gluteus Maximus is approximately 1.6 times larger compared to our closest relatives. Scientists argue that because we've evolved to be upright, walking, running, throwing, climbing, and traveling across the savanna, we had to develop those large glutes. So yeah, the Glute Max, as we'll see, important for a million reasons and a part of our evolutionary edge. The Gluteus Maximus has a pretty broad origin, from the posterior gluteal line of the ilium, the dorsal surface of the sacrum and coccyx, and also from the sacrotuberous ligament. It then runs laterally and inferiorly to insert into two main spots, the IT or iliotibial band and the gluteal tuberosity of the femur. This dual insertion is a big reason our Glute Max can influence both hip and knee mechanics via that IT band attachment. It can deliver some significant force and power, hip extension, and external rotation as well. Just to reiterate, our Gluteus Maximus originates on the posterior gluteal line of the ilium, as well as the posterior sacrum and coccyx, and it will insert into the IT band and gluteal tuberosity. When it comes to the function, Gluteus Maximus is our prime mover for hip extension, especially from a flex position. Think coming out of a squat, climbing stairs, or accelerating for a sprint. Also plays a big role in hip external rotation, as upper fibers contribute to hip abduction. The lower fibers of the glute can contribute to hip adduction, depending on the movement. Because of Glute Max's IT band attachment, it also indirectly influences lateral knee stability, making it a player in injury prevention from the hip down. That sort of emphasizes the importance of strengthening the entirety of the lower extremity when you're seeing pathology in the knee or ankle. It's all connected. So to summarize, Glute Max does a little bit of everything. Primarily hip extension and external rotation, as well as abduction, adduction, and lateral stability. Our Glute Max is innervated by the inferior gluteal nerve, coming from roots L5 to S2. Injury to this nerve, while rare, can result in noticeable difficulty with hip extension and trouble rising from a seated position without using the hands. Pretty simple innervation here, a big muscle but just a single nerve, unlike our gluteus medius. Let's make sure we know that one for sure. Our Gluteus Maximus is innervated by the inferior gluteal nerve with roots L5 to S2. The big, strong vanity muscles are usually more of a focus for lifters and athletes. Glute Max isn't really an exception. but we clinicians do consider glute max in what's called lower cross syndrome, similar to that upper cross syndrome, a combination of muscle imbalances that lead to postural abnormalities, another symptom of our increasingly sedentary lifestyles. Lower cross syndrome could lead to lower back pain and anterior pelvic tilt. The weak core, the weak glutes, and the tight hip flexors and hamstrings will definitely play a role in tilting that pelvis forward. The PTs do tend to throw in exercises like bridges and prone hip extension to strengthen glute max. Patients present with lower back pain. But that being said, glute max isn't just a hip extensor. It's a huge stabilizer in our gait cycle as well. Works in concert with the hamstrings and plantar flexors. Keep us upright during stance. When it's weak or delayed, the entire kinetic chain is forced to compensate. Hamstring and calf muscles will be able to slack, but can only restore about half the lost stability. That's when we start seeing things like excessive trunk flexion, shortened step length, and increased fall risk, especially in higher demand gait tasks. It's interesting, from a strengthening perspective, research shows that high activation exercises like single leg squats and single leg deadlifts are ideal for restoring glute max power and timing. Patients with gait deficits, post-surgical, neurological, or simply just from deconditioning, restoring glute max strength and timing can directly improve balance during ambulation. It can also reduce compensatory strain on synergists and enhance overall walking efficiency. In our athletes, insufficient glute strength limits sprint speed, jumping power, and stability in cutting maneuvers. On the flip side, an overactive glute max can contribute to excessive posterior pelvic tilt, or even compressive loading in that lumbar spine, so more pain. So whether it's a rehab or performance training, restoring and optimizing that glute max function is a non-negotiable. So that's our Gluteus Maximus, the biggest and the baddest. More of a gym muscle, but a big player in posture, gait, and biomechanics as well. We're really just scratching the surface here. But as always, if you learned something new, drop a like, share with your classmates, colleagues, and peers, and subscribe so you don't miss the next installment in our Anatomy Breakdown series. Said it once, we'll say it again, much more in store, even more to come. So stay tuned, stay locked, Shuttle DPT, we'll catch you next time.